was a little fearful of standing up here today, as most people are with public speaking. But in comparison to the women that come to our center, my fear shrinks. I am Anna Gonzalez. I'm the patient navigator for RBSA, the Center for Breast Health. I work specifically with Dr. Karen Carson. And I was asked to describe the breast center. And I could have easily read through the brochure, but that doesn't describe who we are. And I wouldn't know how to describe to you how a heart beats through a brochure. And our center is a lifeline for many women. We are intertwined with different departments from the hospital, including radiology, pathology. We are intertwined with our concierge. We are intertwined with our clinical navigators, our managers, our techs, our nurses. And we are the breast center. And to describe that into words is a very difficult thing. As I mentioned before about fear, the majority of the women that come to see Dr. Carson are full of this. And our job, our passion, and our purpose is to remove that fear and replace it with hope. This is who we are, and this is what we do. And how we go about doing that, I couldn't read through a brochure to tell you. To work at our center, you have to be able to give 100% of yourself. We expect nothing less. And when you refer your patients to us, they're not an add-on. We don't identify them by an MRN number. They're not the next one on the list. They're not the 230 patient. They're your mother, your grandmother, your sister, my cousin, my friend, her niece, her daughter. And when they come to our center, we leave an impression on them. An impression that we're here to take care of you, that fear is gonna leave, that fear has no place in its life, and that we're gonna take care of them, they're gonna live. Replacing fear with hope is a talent, is a gift, and not everybody has the heart to do what we do. So when people refer patients to our breast center, we can't just say, oh, here, we have this, we have that. It's an experience. And when people come, they remember what we did. They remember that we held their hand. They remember that when they left, they weren't as fearful as that monster called breast cancer. It's not just a different department in the hospital. It's not. We strive to provide excellent care to each individual patient that comes here. So I didn't come to bore you with brochures and with the politically correct thing to say. I came to inspire you. I came to inspire you because yes, it is October Breast Cancer Awareness Month, but for every day, it is Breast Cancer Day for us. And there's women that come in there, there's women that have just given birth to babies. And we have to tell them, yes, you were diagnosed with breast cancer. And so instead of breastfeeding your baby, we're telling them you have to remove your breast cancer. You do a lumpectomy or mastectomy. You can't just hand that over to somebody and not have the heart to do what we do every day. We work with our hearts. You can't put a price on that. There's no salary high enough to pay us for what we do. So when you send us your patients, we work with the best, and I don't use this term lightly, the best breast specialist, Dr. Karen Carson. This is her passion, her purpose in life is to eradicate this disease that has taken so many. But in the interim, we're here to give these patients hope. To let them know that when they come through our center, they're gonna have the support that maybe they don't have at home. They're gonna be connected with other women who are gonna be able to tell them, you know what, I made it through that, you can. This is what I did. We are a resource, we are a lifeline to every woman that comes through that center and men that come through our center. From the moment you walk in through our doors, our center has a very calming, soothing atmosphere. From the artwork that's placed on the walls to the brochures that are on top of our tables. We don't have Sports Illustrated on our tables. We don't have the bridal magazine on our table. We don't have anything that would automatically trigger my breast, my sexuality. Because when they come to us, you must realize that women's breasts are their identity. And this is the way a lot of women see themselves. We live in a society where it's all based on a woman's appearance. So when they come into our center, they're automatically thinking, I'm gonna lose my hair, I'm gonna lose my breast, there's no more woman left in me. And that's not the case. We work with two amazing, talented, gifted plastic surgeons, microsurgical surgeons, who use their own tissue, the women's tissue, to form a natural looking breast without the use of implants. We have a support group the second and fourth Thursday of every month that Ida, our clinical navigator, and Dr. Karen Karsiv herself attend to provide these women with the comfort and the resources that they need for that moment. And each woman is different. Some women come in there and say, I got this. Other women come in there and say, I'm gonna jump off a bridge. Each woman needs, there's not a specific package that we're giving these women because they all are tailored differently. Our breast center is trained to red flag these women. When you work there, again, I repeat, we give 100% and nothing less. Kirby can attest to that herself. It's not just a job. It's not. If you don't have passion and purpose driving you behind it, don't show up. Because we don't want you on our team. We don't want you on our team. What I want your mom and your grandmother and your sister and your cousin to know is that when they come to us, we are now their family. We are now their lifeline. We are now their support group. We make sure that when they leave, they're not thinking, you know what? I can't go through this. Yes, you can. Because breast cancer is no longer a death sentence to us. It's a stumbling block. And we teach them how to jump over it. We teach them how to walk around it. We acknowledge the big monster that's sitting on their breast. We acknowledge it. But we shrink it in size by replacing it with hope. So when you send your patients to us, you're not just sending them to the breast center because I said Dr. Karsiv is great. No. The majority of the women that come to us because they were referred by another patient who met and saw and experienced what Dr. Karsiv and her breast team had to offer. So when you think about the breast center, know that not only do we do internal screening, we do external outreach programs. We partnership with the Cancer Service Program. We outreach to the underinsured and uninsured population. We want these women to get screened. Our passion and purpose, our motivation is for these women to come in, and we want to catch these cancers early on. Why? Because I don't want them to walk through our doors and realize that, you know what, out of fear, I couldn't catch this in time. Out of fear of what was to happen. No, we want you to understand that when you come to us, we're going to nip this from the beginning to the end. We're not going to drop you in the middle of your treatment. From the minute they walk into our imaging center and they have a biopsy, and that biopsy is positive, they're met with the clinical navigator. That clinical navigator is basically holding their hand through the whole process. If they choose to come to us, guess what? We hold their hand in that process. There is a lot of hand holding and hugging and crying, but there's also a lot of hope and inspiration. And I want you to understand, I'm not here to try to sell you anything. Each and every one of you is placed in your position with a purpose. You're in a position of authority for a purpose and a reason. You have women tied to your lives that maybe are scared to go get a screening mammography. Be that voice in their ear to get checked. We would love to meet everybody, but we don't want to meet everybody. So I leave you with this. Who is the breast center? I am the breast center. Ida is the breast center. Each and every one of you here is the breast center. We work with passion and purpose. And again, nothing that I can read to you describes what we do and what we encounter on a daily basis. So even if you don't send them to our center, you make sure that every woman that comes in your contact that is of age, that mentions to you that, you know what, my mother had breast cancer, my grandmother had ovarian cancer, that you red flag them and that you screen them and that you tell them, you know what, you need to see a breast specialist for genetic counseling.
You need to get checked for BRCA. We perish for lack of knowledge. My job is to educate you, to inspire you. This is what I do, this is what I live for. And so today, if anything at all that you've taken from this, may my words haunt you. May my words be imprinted on your spirit to speak to every woman in your life about getting screened for mammography. Because you and I, we are the breast center. Have a good day.